Welcome, ladies and gentlemen, to the 6th annual open meeting of the UK Pharmacogenetics and Stratified Medicine Network. My name is Munir Mohammed. I'm the chair of the network, and we hold this annual meeting in March every year, largely to sort of look at what's going on in the world of precision stratified medicine, pharmacogenomics, and bring in a star-studded lineup of speakers. And today is no different. And I hope you'll have a very good day listening to many of the great speakers that we have who've made time to come and talk to you. So I'm just going to give you a background to the network as what we've done over the last year, because it is your network. So our membership is increasing all the time. So we've gone up to about 1,000 members now, and we want to grow. The great thing over the last year is that we've had more clinicians joining the network. And we've also got patients who are members of the network as well. Clearly, what we do here is very much about eventually treating patients and treating them better in terms of precision medicine, getting the right drug to the right patient at the right time. And patients are the key stakeholder in this, so it's great to see that the patients are becoming involved in this network as well. And you'll hear we had great patient speakers last year, and we've got another one today as well. We have a social media following as well. It is increasing. Unfortunately, it is not as many followers as Donald Trump, but we're trying to work towards that. We'll get there eventually, but at least they won't be as controversial, the tweets. We also have a website which is increasing in terms of traffic. And the good thing about the network is that although it's a UK-based network, we very much want to welcome international members to the network as well. And we need to learn from each other. It's not a UK-based activity, it's not a US-based activity, it is a global activity. We really need to bring people together. And you can see the number of people who are coming to our website from all different parts of the world. And that's great that people are interested in terms of what we're trying to do with the network. And as you know, when we set up the network, it is very much about people getting together, interacting with each other, learning from each other, collaborating, developing joint grant applications, and industry making contacts as well with academics, clinicians, etc., to take things forward for healthcare. And as I said, in the last 3 months, we have a 72% increase in web traffic. We have a database of people who are members that you could try to connect into if you are interested in particular areas of the network. Now, over the last year, we have been busy. We have not only these annual meetings, but we have focused workshops. And what we've been doing is really undertaking workshops with key stakeholders, policymakers. So, for example, we held a workshop with the NHS England and Genomics England, looking at pharmacogenomics, the opportunities and challenges of bringing that into the population. And also, there's a 100,000 Genomes project, which has been completed, fantastic, just before Christmas last year. And what do you do with the pharmacogenomic variants? And you'll hear a talk related to that later on. But also the more wider aspect of what are the key challenges, opportunities of being able to implement pharmacogenomics to the whole of the NHS. And how can that be done, and whether that's worthwhile doing, utility, etc., and so on. And work on that at the moment is going on. We also held a workshop with the MHRA, and Steve Lee from the MHRA is here. And that was really on how do you start developing regulatory pathways for genomic diagnostics. What we don't want is to over-regulate, and if you over-regulate, you're going to stifle innovation. But if you under-regulate, you'll end up with the Wild West. And so you need the proportionate degree of regulation, and we need to develop pathways, and it's very much a partnership meeting. You had industry, MHRA, etc., and so that we really want to develop proportionate degree of regulation, and hopefully the workshop can help with that. And there's a report coming out on that, which will be available on our website in the near future. We also are keen that we undertake studies, trials, and so on in terms of precision stratified medicine. And the key group or the network which undertakes trials or facilitates trials in this country is the Clinical Research Network, which is all around the country, funded by NIHR, and that's been fantastic to increase numbers of patients being recruited to trials in the UK. But there have been problems about recruiting to stratified medicine studies. And we went through that, what the problems were, what the issues were, what the challenges were, and have come up with the roadmap for improving recruitment. And the paper from that has been published just recently in the British Medical Bulletin. And you're welcome to read that, but also there are also roadmaps, etc., that you can contact the NIHR for in terms of getting access to that. Last year and yesterday, we held a meeting with global leaders in pharmacogenomics, and many of them are here, and some of them are speaking today. And the idea behind that is to get people from all over the world who are interested in pharmacogenomics, and pharmacogenomics is one part of precision medicine, to start thinking about how we can work across the globe in terms of pharmacogenomics. And what we're trying to do is to develop a global pharmacogenomic medicine network, which hopefully we will develop and launch end of this year, which would be great in terms of really working at scale across the globe. We've got 275 people registered today. I know the weather isn't so brilliant out there, but hopefully 275 will turn up. And the interesting thing is, again, we've got a lot of academics here, but we've got patient advocates as well, and clinicians coming here as well today, which is fantastic as well. Really a very sort of broad community that is coming to the meeting today. We have further things which are going on this year. Later on this year in May, we have a workshop which has been organized in conjunction with Health Education England, which is really looking at what are the pharmacogenomics educational needs for people working in the NHS at the front line, pharmacists, doctors, general practitioners, nurses, etc. So if you are interested in something like this, then please register for that. The workshop is free. It's going to be held here, and this is a great venue to have the workshop. So, I urge you to be able to come to that if you're interested in this area. So, and we're already planning our next meeting in 2020, and that will be held at 11th of March, venue to be confirmed. So again, a date for your diary. So I should finish off by thanking our sponsors today and our exhibitors that are here. And please go and visit the stands that are available, and the people who have turned up today to be able to exhibit in terms of what they're doing in this area. So just thank you again for coming. If there are any particular issues you want to discuss about the network, any suggestions you have, we're very keen to be able to listen to them. If you want to join the network, it's free to join. We're very nice to you. We give you a cup of tea, and we don't charge you either. So if you want to join the network. Christine McNamee, who works as a manager of the network, is the person to contact, and she's been key in driving the network forward. So thank you very much for your attention, and I want to go straight on to the first talk.